new Senator for the Greens, who's also their health spokesperson and is the acting leader of the Greens, I believe, at the moment. So please welcome Richard.
Thank you all for coming on what is one of the most important issues facing the country. This is the biggest attack on Medicare since Medicare was founded in the late 70s, early 80s. Make no mistake about that. So Medicare is the Australian story. It was founded on the principle that it doesn't matter who you are, whether you're rich or poor, whether you're unlucky enough to have been born with a genetic disease, whether you've developed one later in life, whether you're run over by a bus, that you get access to top quality health care. It doesn't matter the size of your bank balance. It doesn't matter how many children you've got at home. It doesn't matter whether you've developed diabetes later in life. What matters is that we, as a rich, prosperous nation, will provide health care for everybody. For everybody. But what this government is trying to do is to tear it down. Is to tear down Medicare. It's never supported Medicare. It's done everything it's been able to undermine it. And this is now the biggest assault on Medicare since its foundation. It's been introduced under a lie. The lie that our health system is unsustainable. Well, let's look at that. Healthcare in this country is affordable. The cost as a proportion of GDP has been steady. And we spend half what the US spends on healthcare, and we've got a much better health system. But we are on a fast track to a two-tiered, highly privatised health system where you get one level of healthcare if you're wealthy and have a high level of private health insurance, and you get second-rate healthcare if you're on a lower middle income. That's not what Medicare was founded to do. It was founded to provide healthcare to everybody, regardless of the size of your bank balance. Whether you're rich or poor, you all get good healthcare. And let's look at the US system. 40 million people who can't afford to see a doctor. Where at the moment, modest health reforms are being introduced with a huge backlash, where people are still fighting hard to get access to some of the most basic treatments that we here take for granted. This is an attack that is unprecedented, and we need to do everything we can to stop it. The amount we spend on healthcare isn't spiralling out of control, it's steady. And what is the point of having a growing economy, of increasing our GDP, if we can't spend some of that money on healthcare? This is a wonderful situation for being. Developing countries right around the world would kill to have this problem. What are we talking about? We're talking about being able to fund some of the most expensive, high-tech medical interventions that allow us to live longer and more prosperous lives. That is a good thing. Don't buy into the myth that our health system's unsustainable. We have a world-class health system. Costs are under control, and what we need to do is to build up Medicare, not to tear it down. Why on earth are we handing over billions of dollars in subsidies to the private health insurance industry when we could be providing dental care under Medicare for every person in this country? See a dentist just as easily as they can go and see a doctor. We can do it. It's a matter of will. It's a matter of evidence, because the evidence says very clearly a single insurer, publicly funded, is not just fairer, but much more efficient in terms of delivering healthcare services. So this is a government driven by ideology. It's putting its ideology ahead of the notions of fairness. Well, we get that. Coalition government has never been committed to fairness, but it wants to spend more money and get a worse product. That is economic vandalism. and we shouldn't stand for it. We are happy to talk to the government about how we can save some money in healthcare. How about we invest more in primary care and try and keep people out of hospital? How about we end those huge subsidies to the private health insurance industry and invest them in Medicare? How about we look at ways to purchase drugs that mean that we can get access to drugs much more cheaply than we currently do at the moment? There are lots of ways of having a fairer and more efficient system, but tearing down Medicare is not the way to do it. Make no mistake, this is a fight that we will be having well into the term of this government. The Greens will be there with you, fighting to defend Medicare, but we won't do it without the unions and without all of you standing together, trying to protect one of the great institutions of this country, something that visionary governments decades ago had the foresight to introduce, and that the reactionary and brutal Abbott government is trying to tear down.